Good afternoon. Everyone can hear me? Thank you so much to everyone joining us today. We're very excited to have our very first panel out of a series of panels that the network is planning for you for the summer going into the fall. Thank you so much to everyone joining us today. And I wanted to start by thanking our sponsors that you saw scrolling on the screen, especially our lead sponsors, Richmond Housing and Concern for Independent Living. Thank you all so much. And I wanted to thank everyone as well who's joined the panel and organizing the panel, particularly on our staff. Rebecca Sauer made our initial connection to Doctors Without Borders and really nurture the relationship that became so very effective for our community, as well as the staff who've worked on the panel, including Joelle and Nikki, McLean and Cynthia. Thank you so much for your efforts. And a very, very special shout out to the Doctors Without Borders team, to both Michelle and Elena, who are ending their journey with us at the end of June. But have been just so instrumental in helping us with COVID and the crisis that we quickly found ourselves in. And really without your support, we would have not made it through, and just are so grateful for your smarts, intelligence, and in partnership. And I think you just impacted so many of our providers. So a huge thank you. So I'm going to, with that, turn it over to McLean, who is moderating our panel today.
Great, thanks, Laura. Can everyone hear me? Great, okay. Well, good afternoon. My name is McLean Bearhopt. I'm the Associate Executive Director here at the network. For those of you who I have not met yet, I'm just so honored to be here today with all of you and our panelists. The goal here really is to highlight some of the critical work that a few of our providers have done with Doctors Without Borders, and to really learn sort of from their advice and guidance on what they've been doing over the last 3 months. You know, two things I just wanted to kind of ground us in as we begin this conversation that sort of stuck out to me over, you know, several weeks of conversations with this team. One, we really need to embrace, you know, the next several months and really brace ourselves for the next 2 years. I don't think any of us feel like we'll be going back to the old ways. We're kind of in the new normal, at least until we get a vaccine. So sort of bracing for the next several months into 2 years is sort of the timeline of which we're all starting to think about now. And also something we learned from Doctors Without Borders, which really has stuck with me, is just that when we think about temporary, usually temporary becomes permanent. So when we're thinking about behavioral changes or building modifications or anything that we're doing in our work, we really should be planning and investing for permanent changes. So I just wanted to throw those two things out just to think about as this conversation goes over the next hour. I also wanted to highlight a couple housekeeping items just before we get started and I hand it over to the panelists. This webinar will be recorded and it will be available on the network's website. We'll also be sending it out via email to all the attendees. So if you want to share it with your colleagues that couldn't join us today, that's absolutely fine. We encourage it. And also all attendees are muted. So if you do have a question, I'll just direct you to the Q&A box at the bottom of your screen. Please make sure to type in any questions you have there in the Q&A. And we will, you know, answer as many questions as we possibly can at the end. We're going to let the presenters give their presentations and then we'll open it up to go through the questions at the end. If you're having technical difficulties, feel free to communicate with Joelle in the chat box. We'll be using the chat box for any technical glitches or any help you might need. So with that, I'm going to introduce our panelists. Today we have with us Michelle Mays, who is the New York Project Coordinator with Doctors Without Borders. We also have Elena Deans, who is the New York COVID-19 Health Promotion Activities Manager with Doctors Without Borders. We have Molly Matamore, the Deputy Executive Director at Housing and Services Incorporated, and Rachel Bleeker, the Assistant Executive Director for Residential Services at Lutheran Social Services of New York. So with that, I will hand it over to Elena and Michelle first, who will be giving a presentation, And then from there, we'll hear from Molly and Rachel and then open it up for questions. Thanks.
Thank you, McLean. It's really nice to be with all of you. Thank you for having us. So as McLean said, my name is Michelle Mays. I'm a nurse. I've been working with Doctors Without Borders for the last almost 12 years, mostly outside of the United States. And I had just moved back to the US at the end of the year and had been kind of networking, figuring out my next move. And that's how Rebecca Sauer got my resume and my contact information and called me and said, hey, would you be interested in helping us out? And I said, well, actually, we're starting some activities in New York and we might be able to do something. So networking works, especially in these difficult times. And Elena, do you want to introduce yourself as well? Oh, you're on mute. You're on mute still.
Goodness. Hi, I'm Elena Deans. I work with Doctors Without Borders as a health promotion activities manager, which is largely involving education and community engagement activities. And mostly I've been working overseas, but I've been on the New York project for the last few months.
So as McLean explained, we are wrapping up our activities in New York, but because normally, as if you're familiar with Doctors Without Borders, we're a medical humanitarian organization. We usually work in places like in conflict settings or in epidemic settings. So we don't normally operate in the United States, but with COVID starting, and especially with the US being the epicenter and New York being the particular epicenter, we decided to take a look and see where maybe, you know, our experience, especially working in epidemic settings, could be of an added value and of use. And very luckily, of course, connected with Shini, and that's how all of this started. So we wanted to talk a little bit about, our experience working with the network and all of you, a bit about the guidance that we've provided, not going into much detail, but kind of giving a little bit of an overview and what has been accomplished kind of working together with all of you over these last few months. So I will say from my part, it's been a pleasure doing everything with all of you. I the very first day went and visited, I walked from my apartment to the Cecil, which is one of HSI's facilities, and then down to the Euclid, which is one of WISFish's facilities, and took a look and met your teams. And I think, immediately it was very clear. There's a lot of similarities between Doctors Without Borders and the work that all of you do, in the sense that we're all very service-oriented people, and we are about, helping other people in whatever way that means. And so there was definitely a lot of really good common ground between our missions and our mandates and what we're looking at. And that, I think, just set up for a really great relationship and partnership. But I'm going to hand it over to Elena to talk more, because she's the one who, once she came, she kind of took over all the Shini's support stuff. So she can talk a bit more in detail.
Great, thank you. So throughout the last few months, we did several different types of activities. Initially, we offered hand washing stations to different facilities. And so many agencies reached out, and we were able to supply them with the facilities to set up a hand washing station in their lobby or near a front door, maybe in an office. There were several different options. Total, we distributed 175 hand washing stations to different agencies, different service providers, to the different facilities throughout the city. We were able to get at least one in each borough, and so we were able to get the reach there, which was really great. We did a number of site visits. And over the course of these last few months, we visited 43 sites. On those site visits, it was largely a discussion and an opportunity to see the facility and to exchange with the staff on site. So I would go and usually meet with a program director and as many of the staff that were available on site. So that might be case managers, often it was facility staff, and it was a really great opportunity to talk through, to see the specific challenges that each building might have, that each population had. Yes, great. To really answer some of those questions, and just a great opportunity to exchange with the different staff. I know I really appreciated it. Doctors Without Borders does have expertise in pandemics and in response to pandemics like COVID-19. And so it was really great to use our knowledge of pandemics and infection prevention and control, and to combine that with agencies and their staff who have their own expertise, are obviously very, very experienced, people who had a long history in social work and in provision of care like this. And so it was really great to sort of combine and have that discussion. Following many of those site visits, often people would request participation in a webinar. Often they would have a standing agency meeting, a Zoom call like what we're all on now. And so we were able to participate in 23 of those. Actually, I think 24. I think I did one yesterday that didn't make the, so we did several Zoom calls, which was a great opportunity to answer some more questions from more staff, often from different facilities. That was great. And then one of the last activities that we had was phones. Often one of the things that came up as we were doing our initial needs assessment was many providers discussed that they had a difficult time contacting some of their clients, and that would be even more difficult now that they were often limited in their movements, and many people were trying to practice social distancing and maybe had reduced hours in the workplace. And so access to cell phones was a highly requested tool. And so we were able to provide about 1,080 phones to different agencies that were distributed to the city, or through the city, excuse me. So that's a very brief overview of our activities. So I think we can go to the next slide, and we can keep clicking. So we've got, so, oh, back one, sorry. So great. One of the tools that we were able to contribute was some recommendations and a guideline document that concerned infection prevention and control. We often use the acronym IPC. So this was really just a document that provided some additional recommendations, some additional ideas on measures that a facility could take to protect their staff and residents. So it had some ideas about the proper use of PPE, how they could manage facilities, how they could manage common spaces, that type of thing. And then it was really focused on how to quarantine, potentially host someone who is quarantined if somebody came positive, or if they just have a COVID-like illness, how a facility could potentially support them. So ways to approach, because there are a lot of communal areas, a lot of shared space in these facilities. So it was some tips on how they could approach those measures. So that's great. And then just to sort of sum up, the two most important preventative measures that we know that have been proven to have the biggest impact are to maintain social distancing, so 6 feet distance between, staying home if someone is able to, and then washing your hands frequently. We know that if these two measures are practiced appropriately and regularly, consistently, then we have a high level of protection just based off of those two measures alone. And then we go to the next slide. And we see that an additional protective measure is wearing a mask. Wearing a mask is an incredibly important tool, something that really does provide a level of protection. We just want to make sure that wearing a mask does not, it is a supportive measure in addition to the two previous measures, social distancing and washing our hands. So we want to make sure that just because we have that mask on, we're not using that as an opportunity to get too close. And then this is just a graphic here that you can see that sort of shows some risk scenarios and how wearing a mask and the combination of everyone wearing a mask can reduce the risk of transmission. So we've got people who are asymptomatic, who do not know that they are infectious and that they could potentially infect others. And then we have people who are uninfected, and the combination of both people wearing a mask provides the highest level of protection. So that's some information on mask. Great.
So just to kind of close us out, one of the other questions that was asked is like, what is our recommendations for a potential second wave? And we said, oh, that we need more than a few minutes to discuss in an hour session. But kind of to repeat what McLean said earlier, I think it's really to focus on looking at the long term. I think in the beginning there was a lot of like rushing, just trying to find masks and hand sanitizer, and just a lot of like trying to keep the boat afloat. And now that there's a bit more space to really be thinking long term about what you need to put in place, because COVID will be here with us for a while until there is a vaccine, until there is more effective treatment. It's going to be pretty difficult to control the pandemic completely, and especially for high-risk populations like the populations that you all work with, well, many people among the clients that you work with. It's going to be really important to protect people as well as your staff. So that's kind of the general principle, is to kind of think a bit more long-term. Yeah, and that's it from our side.
Great, thank you both. As I said earlier, I know there's some questions already, I think, on some of the topics Michelle and Elena just mentioned, so we will be getting to those at the end. Next, we have Molly Matamore from HSI, who's going to talk about their work, borders, some of the tips they learned over the last 3 months, and how they plan to carry some of that work forward. Go ahead.
Thanks, McLean, and thanks everybody. Happy Friday. We made it. So I first just want to say, the network's response to this crisis has been amazing, and there's almost nothing that illustrates that better than this relationship with Doctors Without Borders. But it's been constant, it was immediate, and it's been ongoing. And so we're so grateful. We're so grateful. And I was inspired by Rachel, who you are going to have the good fortune to hear from next, to try and distill sort of our experience down into a few words. And she probably did it much better than I did, but it's not my word. So Misty Copeland, the first African-American woman to be promoted to principal dancer in the American Ballet Theater's 75-year history, said, anything is possible when you have the right people there to support you. And that's what I felt this whole process has been from the beginning. Doctors Without Borders was there, like Michelle said, I think it was April 25th, showed up to the Cecil and met with our team. So a little bit about us and the Cecil, as well as some of our other projects. The Cecil is an 89-unit building, entirely seniors. Everybody's coming through the homeless system. Almost everybody, nearly everybody has an underlying condition, so high risk. What makes the Cecil uniquely challenging is that we have shared kitchens and bathrooms. It was one of the first SROs to come online in the 1980s, so it looks very much like a dorm, and so that had the added challenge of social distancing was going to be difficult. And that was before we totally understood what that meant. And then, it's not to say that our other sites weren't challenging as well. We have the Narragansett, which is 104 units that includes 78 tenants with HIV/AIDS. So obviously compromised immune systems. They also have 2-to-1 bathrooms. So it's not multiple people in a common bathroom. They're sort of suite bathrooms. But there's 2 to them, so they don't have private baths, and they also have shared kitchens. And then we have Kenmore Hall, which is 325 units, and these are studio apartments, so somewhat different than the Cecil and Narragansett in terms of challenges, but also because of the simple scale of Kenmore. That brought up its own unique problems. And then we finally have a 100-unit scattered site program where we have the least amount of control with. So these are buildings that we have 100 households, including 25 families, 75 singles, living in Upper Manhattan, the Bronx, and private apartment buildings. We don't have staff on site. So I go into that overview because the physical structure, the tenant makeup, and the contractual requirements of each of your programs is going to necessarily inform, obviously, your response. However, at all of our sites, we had one overarching goal, which was to keep our tenants and our staff as healthy and safe as possible. And so, yeah, bringing it back to Doctors Without Borders, they just described it as infection prevention and control. I divided it into prevention and management. They're much more succinct and good at this than I am, but better at this than I am. But so we really focused on prevention, reducing the number of tenants and staff who would contract the virus, and management of those with COVID or CLI within our communities, and how to best respond and mitigate further spread. So from the very beginning, I have a feeling that, we see the washing of hands, and we see, social distancing, and we're like, well, where's the high-tech solution to this problem? We want something harder in some sense. And so when Michelle came to the Cecil, and I was home actually with COVID, but I was on the phone, we had a list of questions, and they politely listened and responded and gave us ideas. And then they kept coming back to washing hands, social distancing. And so that brings me to the other point, just about being creative. We saw on the slide before, there was these hand washing stations that Doctors Without Borders helped us procure, and they were great, and they are great. They were what we could get in the moment. So being creative, being flexible. We couldn't get hand sanitizer. It was hard to get cleaning supplies. So we had to manage with what the environment, both inside our building and outside our building, allowed. And I really did appreciate that synergy with Doctors Without Borders, really taking a harm reduction approach to COVID, and to being very deliberate in terms of looking at who we serve and what they're going to do, what they're not going to do, emphasizing communication and trying to get tenant buy-in, which I think was critical. So again, we took advantage of the hand washing stations. We took advantage of the phones. As we go forward and we go into a new phase, we're obviously looking at more permanent solutions. So we do now have the ability to get hand sanitizer. We have hand sanitizer stations throughout our lobbies and throughout the buildings. We're beginning to look much more like a health facility in that way, but that's okay. But we're also, we were able to phase that in as supplies became available. And so, other immediate concerns we had was, okay, in the beginning, we were super scared. We thought the Cecil and Narragansett would have 10s, 20, dozens and dozens of cases potentially. And so how were we going to manage the bathrooms? And so we talked about that, and we actually figured out a plan in terms of, it's not that sophisticated, but in terms of designating certain bathrooms for people with COVID-like symptoms, designating bathrooms for people that are confirmed positive, making sure that tenants that don't have symptoms are aware that they're not going to be using the bathrooms with people who do have symptoms. And also promoting a sense of community and respect amongst our tenants around that messaging. So, and then there was the hotline. So just as soon as, we had additional questions, Doctors Without Borders was generous enough to start a hotline. So when we had questions about food handling, food scarcity is always an issue for our tenants. And so how do you manage that when people still need food more now than ever? And in the beginning, there was all that rush to the supermarkets, right? So we talked that through, and so I just can't say enough about their support, their patience, the fact that often it was, common sense precautions, and we're now at a stage where we can take those more simple measures and implement them in new ways. For instance, we have a new project that's going up in the Bronx. I'm going to look at that lobby and think about, what do I want there in terms of plumbing, right? Because this pandemic is going to be with us for a while, likely when that project comes online, but there's also the next pandemic. So, thinking of more permanent solutions going forward. But if I could summarize anything, or if I could, my takeaway from this experience is, do what we do best in supportive housing, which is know our tenants, communicate. They're resilient and they'll respond. And we have to be creative. We have to be creative in terms of communication, in terms of encouraging behavioral change, in terms of looking at how we can better design community spaces going forward. And because of this group and because of this collaborative, I feel like Doctors Without Borders have given us what we need to really look at those questions moving forward, and to provide us guidance. And as cheesy as it sounds, we can't do it alone, but we can do it together. So with that, I think I'll pass. Thanks for the opportunity to talk.
Great, thanks, Molly. So wonderful to get that feedback and to hear your thoughts about how to move forward. I'm now going to introduce Rachel Bleeker, who will spend a few minutes talking about Lutheran Social Services response and her thoughts on how, excuse me, we as a community can move forward as well. Go ahead, Rachel.
Hi, everybody. I work for Lutheran Social Services of New York. We have 6 residential programs in Brooklyn and the Bronx. 4 of them have shared facilities, kitchens and bathrooms. And I help to oversee the other sites, although my fabulous colleagues do a great job running it all on their own. But I directly oversee the Muhlenberg residence, which is one of the older, larger SROs in New York City. So the building was built in the 1920s, over 100 years ago. And the social service programming by Lutheran Social Services has been there over 20 years. And before we came in, it was a transient hotel. So a lot of the residents who live there, as you can imagine, have been there for a long time. Some have been there longer than I've been alive, and that's a long time. So definitely challenging to work with a community that are older and tend to be set in their ways. And, when COVID-19 first started, I guess the first thought is, okay, what do we do? And then all of this information is coming at you, and you have to sort of decipher what's right and what's wrong. And then when you finally think you have some good information, how do I get my community to, buy in? Because at first it was, they're not listening to me. They're not social distancing. So, while there was a lot, I'm sure a lot of the providers can relate to this. There was a lot of really good information coming in webinars and conference calls and attachments to emails and links to websites. But it was also like a little overwhelming sometimes. And having somebody who can come out to the site in the middle at a time when nobody really wanted to come out to a site was just incredibly amazing and impactful. We were lucky enough to have Elena come out, and right off the bat, having that second set of eyes, Elena was able to see things that I sort of just was glancing over. So like she initially came into the building, and my security officers at the front desk had lowered their masks in order to speak on the phone. So that was just something that I just sort of, maybe it just happened on that day, but I doubt it. So as we walked through, I had a lot of these aha moments. And so I just wanted to share a couple of them. For example, we were speaking and I had stood next to Elena and I said, oh my God, I'm so sorry, I'm not social distancing right now. And she said, that's okay, you're next to me. And obviously we want to social distance at all times, but at times face-to-face contacts are necessary. And so what I took away was, if I am in that situation where I have to be near somebody, it's better to be next to them instead of across from them. And it seems like common sense, but at the time, it wasn't common to me. Also, unfortunately, some of our residents do still smoke. And so I guess almost like a harm reduction model. She said, if you ever get them to wash their hands, I mean, we want to be washing hands all the time, but if ever you want them to wash their hands, it's right before they put that cigarette up to their lips. Again, like another light bulb went off for me. And then we also talked about branding the message. So I felt like I was chasing people around and saying, social distancing, social distancing. And Elena had suggested to me to get more signs up and more branding. I mean, there are companies who actually brand products and brand people. And so she wanted me to brand the message. And at first I thought, well, but they're not listening to me. And, you know, the takeaway was, I don't have to chase anybody around if I brand the message. And they'll start to see the cues all around them. Oh, look at that marker on the floor. That's right. I'm supposed to be social distancing. And so I really bought onto that. And currently we have actually glow-in-the-dark feet prints all in front of the building for where people would hang out, because I'm never going to be able to get them to stop hanging in front of the building, but maybe I could help remind them where they're supposed to stand. We've marked the walls for anybody who likes to hang out against the walls. We have metal signs in front of the building posted. Social distancing doesn't just apply indoors. We have markers in all the common areas of the building on the floors where folks should be standing. So again, there was really this behavioral and cultural shift, and we had to buy into it. So now that we're there, you know, we're able to start talk about reopening and start talking about what the future looks like. And there's all these really fabulous innovations that are coming out. I see them and I think, why didn't I think of that? But we're looking at things like a temperature reader for the front desk so that we can read people's temperatures as we work on bringing visitors back. We look at how do we decrease density in our office spaces. Sometimes that might mean I'm actually moving an office space and moving people into a larger area. Sometimes that might be looking at their schedules and how I can stagger shifts. For example, having people work 7 days a week instead of 5. Or having them work perhaps 4 long days instead of 5. Or maybe there's a paperwork day from home for everybody, but we're looking at these sort of things. We're talking about it now. Again, the culture has changed. You know, I think if I'm being honest, where I got stuck initially was, how do I continue to provide the same level of care to my residents while keeping them safe? And the answer is I'm not going to provide them with the same care. Things are different, and I had to be on board with that. And then it was, how do I still care for my clients? How do I still provide them with services, but how do I also keep them safe at the same time? And I think I had to shift my mindset and shift the culture at my programs. What Molly was referring to earlier is that anybody who knows me knows that I love a good quote. My office is covered in them. And even in my work with my clients, even during this time, I felt like I always wanted to communicate with them what was going on, why it was happening, what we're doing now. But I didn't want to be, every time they opened a letter with my name on it, oh God, what now? And so I find the use of quotes to be so powerful. I feel like it gives you a way to put things succinctly into words, or to have a mantra or a motto. And so I try to use quotes to help inspire my residents, to inspire my staff, and it inspires me. So throughout the pandemic, the one that really has helped me is Jackson Brown Jr. And he says, be brave, even when you're not, pretend to be. No one can tell the difference. I love that. I love that because it's not saying that, you know, being scared, just ignore it and who cares about your feelings. We care about feelings, but it's acknowledging that sometimes we don't feel brave. And, you know, to all the providers out there, like, I don't know about you, but there were moments where I checked in with myself and I was like, I'm not okay right now. Or I don't know what to do. And so I would just encourage you in those moments, if you got a great team, lean on them. Your funders, rely on them. And certainly the Supportive Housing Network of New York, I mean, they became my friends. I called them when I needed them. When I saw the opportunity to have Doctors Without Borders come out, I was right on it. And that would be what I would encourage all my colleagues out there. I think Molly sort of spoke to it, but like, we are definitely physically apart, but we're in this together. And so that would be my parting words. Thank you.
That was so lovely, Rachel. Thank you. Thank you for your thoughts. And I love that quote. I actually wrote it, we had a prep call the other day. I wrote it down. I keep looking at it thinking it's absolutely true. We're all in this together, and you know, we'll get through it. We will get through this together. And I, you know, on that, I just wanted to reiterate, I think Laura mentioned at the beginning that while we're so sad that Doctors Without Borders is going to be exiting our community very soon, you know, we have this that we could share. We have learned so much just about the simple things that we can do and how to implement that in our organizations, in our offices, in our residences. They were kind enough to actually put together a document that we will share to all the attendees that sort of talks through all the things to consider in your offices and your residences. So we'll share that. At the network, we're getting ready also to launch a safety guide document that's about, I think it's a dozen pages of just tips and thoughts to think about how to reopen in the new normal. That we use the Doctors Without Borders guidance, as well as all of the state and city guidance documents that are out there. And we've been working with about 15 of our providers every week, just that Molly's a part of, just thinking through all of these questions that people have had. And, you know, many of the tips that Rachel mentioned are in this document of things to consider, how to do the social distancing, how to communicate with your tenants and staff about that, thinking about staggering staff and ideas around how to do that. So we'll be making sure that all of you have that as well, to help just rethink sort of how we work in this new normal. And I think that was actually one of the questions we had. So I'm going to now sort of transition into the question part of this. We have about 20 minutes left before our workshop is over. So one of the first questions we have is, how do you manage the mask after taking it off? Can you take it on and off and just keep using it? I think I'll hand this question to Alina and Michelle to answer.
Great, thanks. So I would say that partly depends on the type of mask that you're using. I mean, how you can take it on and take it off. Well, every time that you put on a mask or take off a mask, you should wash your hands. So you should wash your hands before you put on your mask, and then go about your day. Avoid touching the front of your mask. Avoid, you know, don't take it down to talk on the phone, as we talked about, or to talk in general. So when you're putting on your mask, you want to take that time, because you've just washed your hands, so you want to take that time to adjust the mask so that it's really comfortable and it has a good fit that covers your nose all the way to your chin. And then if it is time to take off your mask because maybe you're going to eat, or you're just, you know, you're ready to take it off, you're alone, you can take that mask off. You want to put it somewhere safe and clean. We would recommend maybe like a paper bag, some kind of breathable container. You don't want to put it in a Ziploc bag or other type of sealed plastic container that can create a humid environment, and ultimately bacteria or other kinds of viruses, yuckies, can grow in that on that mask. So you want to make sure that you're putting it in something clean and breathable. As far as how long you can use a mask for, if you have a cloth mask, you can wash it every day and then use it again the next day. Let it air dry. You can wash it in the sink, soap and water. You could throw it in with your laundry. All of those are great options. You just wash a mask the way you would wash any other piece of fabric. It doesn't need anything particularly special. If you're talking about one of the disposable masks, some people call them surgical masks, some people call them procedural masks. They're usually blue and white. This type of mask is not meant to be reused. This type of mask is a disposable mask. It's really not meant to be re-sanitized or anything like that. So if you've worn that mask for the majority of your workday, for instance, it's time to let that mask go and to change it for a different mask. Certainly, if a blue surgical mask gets wet or damp, or if it has a visible, if it looks dirty, or it has it's got rips or anything like that, then it's definitely time to let that mask go and to change it for a new one. If, on the other hand, you are able to socially distance, maybe some of your residents or maybe some other people who are able to work from home, and so you're spending the majority of your day inside in your home, maybe you're only going outside for some fresh air or to go to the grocery store or other types of necessary errands, and you're only wearing that mask for a short period of time, then you could store it and you could use it again the next day for your next outing, assuming that you've kept it dry and clean and you haven't had any issues. But the main thing to keep in mind is that those blue surgical masks are not designed to be worn for long periods of time. They're not meant to be. They're designed to be worn for a short period of time and then thrown away. They're not designed to be sanitized. I have people ask me all the time, like, if they can spray it with Lysol or if they can throw it in the dryer for hot air to hopefully clean it or something like this. And these types of masks are not meant to be cleaned in that way. And if anything, you risk damaging the mask. And now you've got chemicals on the mask that you're breathing in. Like, it's just not a great idea. So this is why I personally prefer a cloth mask. Michelle, I don't know if you want to add anything.
No, that's great.
And I'm gonna stick with this theme. Elena, could you speak? Is it safe to wear gloves or not? Should people be wearing gloves? And also, could you address face masks as well? I know this is something the shields that people been, both of those. That would be great. Thank you.
Okay. Yeah, sure. So when it comes to gloves, I think a lot of people get there's some misconceptions about gloves. You see a doctor wearing a mask and gloves, and we tend to put them on the same level and think, okay, the doctor has a mask on and gloves, and I've been told to wear a mask, so I'm automatically also going to put on gloves. But the fact is that gloves are not quite in the same category as a mask, and gloves are really a case-by-case basis. And for most of us, there's no need to wear gloves. When a clinical care provider, a doctor or a nurse does wear gloves, they wear them for short, distinct periods of time. You're not going to see a doctor put on a pair of gloves and then go about their business for 2 hours, because think about all the things that you could touch in 2 hours. You're going to touch your phone, you're opening doors, maybe you're opening cabinets, you're filing papers. All of these different objects that you're touching with your gloves can contaminate your gloves the same way that they might conceivably contaminate your hands. And the thing with gloves is that they tend to give you a false sense of security. So people have gloves on and they think, I'm safe, I have on my gloves. And then, they're still touching their face, or maybe I've seen people eating with gloves on, or people with their phone up to their face, and all of that. The main point here is that you don't want to touch your face, and you don't want to get any of the yuckies, any of the virus that's on your fingers onto your nose, mouth, or eyes. So for most cases, there's just no need to wear gloves. Times when you might want to wear gloves are if you are taking care of a sick person, if you're doing some kind of cleaning that involves harsh chemicals, or potentially food prep. Like, there are instances where wearing gloves can be the right choice, but the way that I tend to think of this is that glove use is for a specific activity. And so if I'm doing an activity that requires gloves, I would wash my hands, I would put on gloves, I would do that activity. When that activity is finished, I would take off the gloves, wash my hands again. That's the key as well, is that you need to keep washing your hands, and then dispose of those gloves. So, but in general, there's really no reason to have gloves on for a long period of time and going throughout your day. When it comes to face shields are really meant to replace goggles. They're really not designed to replace a mask. So clinical care providers might wear a mask and a face shield. You've often seen, I'm sure you've seen the photos of nurses and doctors who are on the front lines, and you know their whole PPE getup involves multiple layers here, right? The face shields are also really designed because of the potential for splatters, because you are very close to someone, and there's the potential that some of these droplets could get onto your face. But for most of us, we're not really getting that close to someone where that's necessary. The other thing about a face shield, as we've discussed, a lot of people, when they have mask on, this is something that can be a little bit uncomfortable, and so people tend to adjust them a lot. They're touching their face, they're messing with their mask. It's the same with a face shield. If you're not used to wearing it, then you're going to risk contaminating yourself as you touch it and kind of move it around and try to get comfortable. So face shields are really only necessary in a clinic. And if somebody is not wearing a mask with a face shield, then there's much limited protection there. The mask is really the key.
Great, thank you. So I think we'll switch this question to Molly and Rachel. Any recommendations on how to encourage residents to adhere to prevention protocols, including wearing masks, washing hands, social distancing, avoiding large gatherings? Could you talk about any ways of which you've been doing this in your residences?
Sure. So I'm sure we both have ideas and probably a lot of the same similarities. But for us at HSI, one of the things is having masks available, like a lot of masks available. So one, being able to make sure that we're giving them what they need and encouraging their use, and that they're seeing us use it. So, you know, when we're walking around as staff, we're making sure we have our masks on, and we're making sure that they don't see us asking them to do something that we're not willing to do. In terms of, you know, the congregating, we've really limited and have not changed that, and are not planning on changing that all that time soon. You know, our learning centers, our community rooms, our community spaces are right now shut down. So right now, there really aren't many places for tenants to congregate in the buildings. I loved what Rachel was saying about the idea of doing something outside in terms of designating where people sit outside, because they go outside. And that's one thing, if you have outdoor space, one thing we've heard a lot is that being outdoors is great. Fresh air is great. So whether you're opening windows, which is something we do try to do in spaces that we can, or if you're you happen to have some sort of backyard space or rooftop space, those are great options. Rachel, you have some, let me pass it on to you.
I can take the next one. I think Molly said it great.
Okay, great. How can I assist the staff in a supportive housing building to feel safer when they come to work? Any thoughts on this? Maybe Rachel?
Yeah. I mean, I think that there's no way that I can make the staff feel 100% safe, because things are not really 100% safe right now, right? So I don't want them, you know, thinking, yeah, everything's okay, because to be honest, it's not. But I can help them feel that we're on top of the issue. And I think that, you know, first of all, who knew that one of my talents is procuring PPE, but my office is filled with masks and hand sanitizer and gloves and shields. And so they know, like, okay, she's got me covered, at least physically, she's got me covered. And then it's sharing information. You know, when we've had several cases of COVID in our building, so it wasn't a big secret to my team about where there was illness in the building. So I was sharing information with them. And I think that those two things together, I think sharing information so that they're not just operating in the dark, and letting them know that, like, I'm looking at shields that I could put up at their desks, and I'm looking at all different ways to keep them safe, I think lends itself to having a staff that feels more secure.
Molly, did you have anything you wanted to add?
No, I think Rachel did great. You know, I think the one thing that I've heard from our staff is that they come back and they keep seeing something more that we've added. And I think that gives them the assurance that we're not sort of looking at this being like, oh, we got this covered and we're done. And so like Rachel said, we're, you know, shout out to Dan if he's watching, our director of operations, who created shields for people's desks with, you know, that came out very well. You know, we're continuously adding and taking suggestions. And I think just that openness and honesty and transparency is so important. We can't pretend that it's a different environment. It is, and it's a scary one, but we're addressing it the best we can every day.
And I just want to add too, you know, we're still having staff meetings, but they're not done in person. But the supervisors are also allowing the staff to vent how they're feeling at the staff meetings. And I think that's important, acknowledging feelings. And, you know, also listening to our staff, because I don't know everything and they might have an idea that I haven't thought of. And so I think that that's important as well.
At the network, we've also been hearing just because of the state's guidance on reopening for offices, they're requiring staff to be sort of monitored every day as they're coming in and out of the buildings, as far as how they feel, if they have symptoms. I know this, my sense in talking to everyone is that it's very daunting and it's challenging to sort of monitor this every day, but I would imagine as well it's giving a sense of security to the staff as well. If they're sick, they shouldn't be coming to work, and that you're, as an organization, taking it very seriously as well. So I can see both sides of how it could be comforting, but also challenging to do every day. Okay, we have another question. I'll kick this to Elena or Michelle. What about using UVC for sanitizing? Is this safe? Should people be doing this? What are your thoughts?
I see Elena is keeping on mute because she wants me to answer this question. I'm actually going to, I think that the science on this is not fully developed yet. In terms of the efficacy, I think there are a lot of companies and businesses that are popping up with this, that, and whatever study and evidence and whatnot. I mean, I really will go back to what Elena said before. Like, the core is social distancing, washing your hands, and wearing a mask. Everything else is actually, I will steal from what Elena says, is the cherry on top. Like, if those are the things that we know for sure really can stop transmission of the virus. So it's important to make sure that you really have those things in place and not to rely on the newfangled technologies and whatnot that come out where the science is not yet sure and the evidence is not yet there. We know that it's working. We've seen it working in this pandemic. So I would say, like, I mean, it's great to keep on top of the technologies and the things that are developing, but unless you have those three things in place, everything else is kind of really, well, is secondary.
Yes.
I said that right, Elena. I'm stealing her lines.
No, I think for me, that's exactly what Michelle's saying. We come back to those three things. You know, like, will there be some innovations and some new products and some new things that are able to help us adapt our workspaces? Certainly, that's definitely, like, that will happen, I hope, and I hope it continues happening. I am a bit skeptical whenever I hear about a new salesman who has, you know, some cleaning solution that's going to be the end of it, and if we all just buy that. That's not to say that these new products, new innovations won't come along, but for the moment, the things that we know about, and I'm just a little bit hesitant to tell anyone to go change out all the lighting in their buildings when the data is just not all the way in. So, yeah.
Another question, and this is a hot topic right now about visitation. So Molly, Rachel, any thoughts? Are you starting to let visitors in? I know the state and the city for a long time have been sort of saying not to do that, but I think things are starting to change, and curious your thoughts on that and if you've changed your policies at all.
So this is Molly. Yeah, we recently did. We wanted to wait, or there was certainly internal debate amongst the team. We were trying to hold off until the 4th of July passed, just to get through that initial weekend. But we recently started letting guests back just this Monday with restrictions. So guests can only have one other guest. The guest must arrive with a mask. Our front desk are asking if there's any symptomology. There are signs at the door saying, do not come in if you have any signs of, COVID-19, and we list the signs. Now, part of the thought process on that is that, our tenants were really getting back to us about being, seeing everything opening up and knowing they have rent stabilized leases, and they know that I can have somebody in my home. We are telling them not to, and that we really strongly suggest they don't. And most of our tenants are heeding that. But we have had some guests. We haven't had any incidents. We're taking a very strong approach in terms of if we see any tenants going, guests going from tenant unit to tenant unit, they're only allowed to go to the one unit. So we have some safeguards in place. We're beginning to relax it, but we're also watching. And if we start to see an uptick, or if we start thinking that there's any sort of issue that's coming because of the gas, we will quickly, hopefully, be able to identify it and then regroup. But we want to be able to ask our tenants in the future if we have to go back to quarantining and isolation because there's an uptick, to do it and to trust us and to know that when we can be more relaxed, we will, and when we can't, we won't.
Great, thank you. We are right at time, believe it or not. I feel like we could continue this a lot longer, but I just some closing remarks. I would like maybe if we could try to get it through in 1 minute. Curious from Doctors Without Borders, just based on your worldwide experience with infection control, is there anything you could say about specific strengths that are sort of embedded in our model in terms of facing this pandemic that we should be thinking about? Any special challenges we face looking ahead? And I think we'll use that to close out. And I want to just say thank you for joining us today.
Yeah, I'll say really quickly, I think what you guys do really well and what is the strength of your model is that you really look at the whole person and the clients that you work with. And what we often see in epidemic response, including the current epidemic responses, especially at the governmental level, the focus is really just on fighting the disease or the virus or whatever that one problem is. And, for most people, myself included, I have many things in my life. COVID is just one of them. Like, there's a lot going on, and you can't just focus on the disease without really looking at the whole person and their, the lived experience of that individual. So I think you guys are already doing this, is really taking that holistic approach that you have anyway with your clients and trying to bring COVID into it. I think the biggest challenge is exactly what you were saying before, Rachel and Molly, like adapting your working style, adopting a new one, because the way that you have been working with clients before and that things are so face-to-face based are not going to be possible in the long term. Like, it's not just about the last few months. It's also probably, I don't know, I don't want to commit to a timeline, but for until there's really a vaccine and really an effective treatment, it's going to be a problem. And I think that that's where the creativity really comes into play of, how can you support the whole person and, really provide those services that are so essential for these people, especially during a difficult time like now, with all these limitations. And yeah, that's going to be the challenge moving forward. But I think, you know, you guys are used to being creative. You're used to thinking outside the box with limited resources. I think you are about as well set up to succeed as you can be. So I really applaud the work that you guys are doing. It has been such a pleasure to work with you these last months. We've learned a lot from you and really respect and admire. And I am grateful for the work that you are doing in my community in New York. So thank you very much.
Thank you so much. With that, I think we'll close. I just want to give special shout out again to all of our panelists. Really appreciate you being here today with us. And yeah, take care. Look forward to seeing our, we'll share a copy of this as well as the Doctors Without Borders guidance and our own safety plan coming out soon. Take care.
Woo!